electronic health record? Why do people hate this thing so much? It's a constant, I see it up here as it's leading the charge. Christine just mentioned it. What's...
I agree with Christine, and we had, previous to this, a lot of discussion about workflow. So there's a couple of points I want to make. One about the electronic health record. If it is implemented without a change in the workflow in the office, too much data entry falls on the physician. And that is what is, in my mind, adding to the huge burden. Then you compound that with something else. We've gone to value-based care in many of our practices, and whether we're in an ACO or we have a shared savings where we have quality metrics that we have to attend to, and that has added and compounded what we have to enter into the electronic health record, particularly in primary care, but definitely in other specialties. And so I think that has, it's not only the electronic health record and implementing it properly with the right staff support, with the right training.
I mean, wasn't this supposed to be a panacea? Like it was going to make things efficient? And
you know, I never thought it would be a panacea. It is increasing your ability to collect data, but somebody has to put it in. And if it's all falling onto a physician, then you're going to increase the burnout rate. And I've put in several electronic health records that have been part of the implementation. And I've seen physicians at their wits' end, absolutely, panic-stricken about how they're going to see patients and do what they have to do.
A wonderful essayist in the 70s, Lewis Thomas, wrote about halfway technologies and defined what they were and described the fact that they were so costly and so painful for patients. And the electronic health record, unfortunately, was introduced as a halfway technology. And it has taken so much time away from the relations that doctors entered medicine to establish with patients and provide caring. There's an annual study done at Hopkins that showed that this year residents are down to spending 10% of their time with patients and 45% in front of a computer screen.
The other piece of it, besides the amount of time and how overwhelming the EHR is, and everybody's carried away with collecting data, it's really disrupting how we train the next generation of physicians. So one of my major concerns, the residents, in addition to spending all the time in front of the computer, they're cutting and pasting, they're not learning to think, everything is about an algorithm, and I know that this is a little bit of a sidestep from burnout per se, but what is meaningful, or is what everybody's been talking about so far, which is our capacity to really take care of our patients, help them, make them well. It's why these kids went into medicine in the first place, and they're not learning how to think anymore or to relate to the patient. So I think that healthcare is suffering on multiple levels and leading to problems that are going to be very bad in the future.
So I think it's a really complicated issue, and I think it's not fair to simply scapegoat the EHR as the sole problem. It's not just the design of the EHR, which certainly could be much better. It's not like our iPhones, right? That our EHR should be designed to be delightful. But it's also the implementation, because in many organizations, rules such as meaningful use have been overinterpreted by the local institution, with the result that physicians are the ones who are doing all the data entry, as if meaningful use required that the physician did CPOE, which it does not. Computerized order entry, that can be something that's shared among the team members, but many institutions overly interpret this, and so that's a pain point for physicians. So it's the design of EHRs, it's the implementation of EHRs, and then it's the regulation.
Yes.
And I think all of those have combined to make this a source of pain for physicians and a barrier, as well as an assistant, but a barrier to providing the kind of care that we would like and to having the relationships that we would like with our patients.
So, I see there's upside and downside. It's not just a black and white answer. It's very complicated, as Christine has said. The panacea part, the part that from somebody who's managing physicians and practices and trying to organizationally improve quality and care, you can get aggregate data that does help you manage. But having said that, you have to go, we're here to talk about physician burnout. how that data gets in is the critical part. And sometimes I see people blaming it on the EHR when it could be the EHR and it becomes cumbersome. But it also is how we have designed our workflow, what kind of training you've gotten, and what we're demanding of you to put in this computer. So sometimes, I see where it's really clear that it's not the design of the electronic health record, it's how you've managed to get that data in.